Today, I am reporting that we confirmed 96 new cases of COVID-19 in Alberta. This brings the total number of cases to 968. Of these, 174 people have now recovered. That is 32 more than yesterday. We suspect 108 of our total cases may be community transmission, an increase of 14 from yesterday. I am also pleased to note that we conducted more than 4,000 tests in the last 24 hours as our lab continues to work at maximum capacity. Of these tests, approximately 98% came back negative, similar to previous days. Sadly, I must report 2 additional deaths related to COVID-19. One was a male in his 90s at the Mackenzie Town Continuing Care Centre in Calgary. Another, a male in his 80s in the North Zone. My sympathies go out to the family and friends of these individuals. We now have 74 confirmed cases of COVID-19 in continuing care facilities, and I expect that more will be confirmed in the coming days. This includes 65 confirmed cases at the Mackenzie Town Long-Term Care Centre and 2 new cases at the Manoir du Lac Retirement Home in the North Zone. All other cases have previously been reported. As of today, there are 9 outbreaks at continuing care facilities across the province. Some of these have been opened due to staff working both at the Mackenzie Town long-term care facility and another site when these staff have been confirmed as a case. This is a precaution that we take to ensure that if there has been exposure by that staff who is now a confirmed case, that any measures needed to prevent spread within the second long-term care facility are taken immediately. These additional outbreaks include Cedars Villa Extendicare, Aged Care Seton, and Care West Sarcee facilities in Calgary. I want to emphasize again, these outbreaks are a precaution based on staff positive testing. In addition, we have confirmed 1 case at the Sheriff King Home Women's Shelter in Calgary. The safety in these facilities is a serious issue and one that is being faced across Canada. I know that residents and their families are concerned, and I want to stress that I hear their concerns. Please know that we are doing everything possible to protect them from COVID-19. On March 20th, I ordered that all visitors to these facilities be limited to only those who are essential in an effort to prevent the spread of COVID-19 to residents. Since then, I have also issued updated standards for operators and staff of these facilities, including enhanced cleaning protocols and health screening measures to prevent outbreaks from occurring. However, it has become clear over the past couple of days that we must do more to protect those in congregate settings. That is why, effective today, I am issuing new standards that operators and staff of these facilities must follow in the event of a suspected or confirmed COVID-19 outbreak. These new standards, enforceable by law, will help ensure that those living and working in congregate settings are kept as physically safe as possible and will mitigate the risk of further spread within and between different facilities. Under the new orders, staff and operators will be required to notify public health as soon as a case is suspected or confirmed, and if 2 or more residents exhibit COVID-like symptoms. Staff who may work at multiple facilities are required, when there is a confirmed outbreak, to immediately inform their supervisors if they have worked at or are working at a facility where there is a confirmed or a suspected case. New directions are also provided on how facilities must operate in the event of an outbreak. These expectations are designed to limit the risk of spread while ensuring residents can continue to receive the care they need. People will likely be aware that in British Columbia, they have taken steps to make sure that across the province, workers are required to work in only 1 long-term care facility. And so that's something that we are looking at and assessing the feasibility. We understand that there could be significant workforce shortages if we were to go down that road. So we can't take that measure without really carefully considering what other measures need to be put in place to mitigate staffing shortage, because people who live in these facilities need safe care, and they also need to be protected from exposure. So today, the measures that are being put in place with respect to outbreaks say that if there is a site that has a confirmed case of COVID-19, that any of the staff who work in that site, again, must notify their supervisors that they will not be dismissed, so that they cannot be fired for that purpose. However, the staff who work in that outbreak facility in an ideal world would be working only in that facility and not at any other facilities. But each situation will require work with Alberta Health Services, public health on the front lines, because we need to balance the need to make sure that facilities stay staffed, also with making sure that we limit exposure. So again, the orders today are about, as much as possible, limiting staff to just one facility. This is an important measure, but we must all do our part in keeping the most vulnerable members of our society safe. If you are feeling ill in any way, stay home. Practice physical distancing whenever you're out in public. Continue to practice good hygiene by frequently washing your hands with soap and water. I cannot stress enough how important these measures are. COVID-19 is spread by close contact, which means every one of us must do our part in breaking the chain of transmission and keeping ourselves and others safe. By limiting the spread, we can help keep the virus out of nursing homes, shelters, and countless other places. I know this can be difficult, but it is the best way to limit the spread and save lives. By the end of today, it is likely we will reach over 1 million cases of COVID-19 worldwide. The way we go about our lives has changed, and we must continue to adjust to the new normal. To help protect ourselves and to protect our friends, families, and neighbors. This virus has shown how much our individual actions, no matter how small, can impact the lives of others and the tragic consequences that can result. We are all in this together, and we all have a role to play in keeping each other safe.